When it comes to maternal and infant health outcomes, Canada barely ranks as average compared to other developed countries. But Kamitra Ashman's experience was not even that.
I felt invisible, neglected, and disrespected.
Ashman's first birth was a cesarean section. Her son was overdue, even though she says she was ready to give birth earlier.
I do not believe it would have ended in an emergency cesarean. Had they listened to me when I said at 37 weeks, my body feels ready, my pelvis is opening, what do? I was directed to go, oh, no, it's too early. Go put your feet up.
Research and data about Black birth experiences in Canada are limited. That's a problem for doctors who treat Black patients.
We kind of live in a bubble whereby we don't think there is disparity within our healthcare system. More so, our healthcare system is free for everyone, it's universal.
That bubble was popped 5 years ago by one seminal Canadian study. It found potentially riskier preterm or premature births were experienced by about 6% of white moms and nearly 9% of Black moms. Better outcomes than the US, but still strikingly unequal between Black and white. Black women in the U.S. are also at higher risk of infertility, hysterectomies, pregnancy complications such as preeclampsia, C-sections, and dying in childbirth.
For our country, we don't have that data, so it's difficult to know exactly what we're dealing with, but we can only extrapolate from other countries.
Countries like the UK, it has universal health care like Canada and is starting to collect more data about race and ethnicity. And it's finding Black women often have shorter pregnancies, have higher rates of miscarriage, and are 4 times more likely to die in pregnancy and childbirth than white women. Statistics that leave questions for Canada.
Why are Black women being disproportionately affected, getting pregnant, staying pregnant, and also dying during their pregnancy and after the birth of their child?
I see the redness you're talking about. Mm-hmm.
The lack of research about Black maternal health has consequences. This midwife says the void is often filled by misunderstanding.
There's a myth, really, that Black women experience less pain than white women. And so this can result in Black women being offered less pain medication. Even though showing overt signs and asking for it, they're being dismissed.
Myths and a lack of data, that translates into hurtful stereotypes about which Black pregnant women have long spoken out.
It started when I came to check in, and I had a nurse at the front desk roll her eyes at me. It's built into when you go to appointments and people assume you don't have insurance. They assume you're not educated, assume you're a single mother, assume you don't have a husband.
Early in the pandemic, Black communities were at high risk of infection, and initially no one was tracking that. That has since prompted Canadian researchers to come up with national standards for race-based health data to identify disparities among all Canadians.
For the most part, they don't really tell you what your risks are. They just kind of like, okay, you're pregnant, this is it.
In the end, Margaret Akamoa Boateng was fine giving birth, no complications. She credits in part having with her in the delivery room a Black doctor, which Canada doesn't have enough of relative to the Black population.
He had another doctor there with me who was Nigerian.
Oh, okay.
He didn't have to be there, but the doctor brought him in, and it was just really? It was great that there was someone else, because the doctor himself, he was white. And I was just like, I'm looking for someone who has Black experience. Only because I feel comfortable if the doctor is Black or their staff is Black or they've ever operated on Black people. It makes me feel a little bit comfortable.
The experiences of being Black and pregnant have prompted a call to action by Canada's Black doctors.
So these are things that we need to acknowledge that it exists within the fabrics of our system, and then we have to acknowledge it and then find a way to dismantle the racism and also to correct the inequities within the healthcare system.
I'm tired. And I believe everyone, every black woman, every black man, people going through this, we're tired. Who's protecting us? We trust ourselves to a medical system that is failing us. It starts with data. It starts with race-based charts. Look at me based on who I am and not based on a chart that doesn't apply to me, because you are neglecting me and you're willfully putting me in harm's way when you do that.
Vic Adopia, CBC News, Toronto.